My name is Natalie Thurmond. I am an Auburn University nursing graduate student, and I am doing a video of 5 interrupted simple sutures. So I would be wearing gloves first in a clinical setting, and then I would start by doing a debridement of the wound using either chlorhexidine or sterile water. And careful to avoid hydrogen peroxide, as hydrogen peroxide can destroy the normal flora of the skin. So this needle is clean, so I'm okay to pick it up first with my hands, and then I'm going to use my pickups. I am going to take my hemostats and attach them to the very end of the needle. I'm going to take my fingers out of the end for better dexterity. Going on the opposite side of the wound, I'm bringing the needle under the wound. And then I'm going to use my pickups to hold on to the end of the suture and grabbing the other end of the suture with my hemostats. I'm going to pull the suture all the way through. I'm going to leave like 1.5 inches of thread. Now with the long end of the thread, I'm going to wrap the thread around my hemostats twice. Then I'm going to open the hemostats just a little bit to grab the far end of the thread. And I'm going to hold the thread steady, and I'm going to pull to bring into a knot. Then I'm going to maneuver the long end of the thread over to the proximal side of the abrasion. Now I'm going to just do one motion and one tie, but I'm going to do it in the opposite direction every time. And I'm going to tie it about 4 or 5 times just to make sure I have, just to make sure it's holding. Then with my scissors, I can cut, and I'm going to leave a little bit longer than I need right now because I can always go back and cut at the very end. Okay, so that was one suture. Now I have 4 more to go. So in between each suture, I am going to leave about 1/2 inch of space. And the spacing really is dependent on how large the laceration is, and also where on the body that it's located. Anything on the face is going to require a little bit more sutures than somewhere like on the trunk. Fingers will also require more suturing. And one thing that I forgot to mention earlier is that I would be applying lidocaine just under the surface of the skin for the patient's comfort level. And if I could use lidocaine with epinephrine to decrease bleeding, but only on like the trunk, the arms. Lidocaine with epinephrine cannot be used on the face. Or also, I believe it can't be used on the hands because it can cause some damage. But if this were, say, on the leg or on the buttocks, I could use lidocaine with epinephrine to cause vasoconstriction and decrease bleeding. Okay, so with that suture, I did pull the string all the way through, so I'm gonna have to redo my third suture. Again, I'm making sure that I'm using the proper spacing every time. Okay, be sure not to make that mistake again. Okay. Oops. And I'm making sure to grab the end, the very end of the opposite side of the thread, because grabbing in the middle can cause it not to tie correctly. Okay, that was my fourth. Now I'm on to my final suture. Oh. Sorry, it popped away. Okay. Okay, so now I would just, I'm going to kind of move the sutures so they're all on one side, and then I can cut, off the extra pieces just so it's not too long and aggravating to the patient. I would instruct the patient to return to the office in 7 to 10 days to have the sutures removed. On places where the patient has a lot of movement, I would have the patient have them come back to get them removed in a longer amount of time, like 10 to 14 days. I would tell the patient to keep their sutures dry and clean, especially in the first 24 hours. And I would instruct the patient that they can use Vaseline over the sutures if there's any skin irritation. And I will show you my 5 simple interrupted sutures.